Okay, I think we'll go ahead and get started. Thank you all for joining us this afternoon or this morning, depending on where you are. It certainly is a pleasure to be with you all virtually. We're all getting used to this very virtual life. For those of us that didn't have it before, we certainly have it now. And I think this is a great use of our time today to be together talking about some very important issues. My name is Stacy Stewart. I'm the president and CEO of the March of Dimes. And welcome to our first episode of Healthy Moms, Strong Babies. This is a series that we just launched today. We're trying it out. Hopefully it goes well today. But we're doing this because we know so many women and so many families are looking for information that will help them navigate all of the issues that are affecting us today, even more so than ever, around maternal and infant health. And we know that this is a particularly stressful time, not only for people in this country, but for everyone around the world. This is a global health crisis, a pandemic like we've never seen before, most of us in our lifetimes. And so this is really an important issue, and we want to make sure that we're really reaching those individuals, those moms, especially now, that are pregnant, that cannot delay their due dates. You can't delay when you want to deliver your baby. So right now, you need to know what you need to know about what to expect while you're expecting, what to expect when you're ready to deliver your baby. So we want to thank you all for joining. We are facing an incredibly disruptive time in our lives with work, school activities, things being canceled, postponed, some very, very trying times. But it's nice to know we can all come together and support each other with friends and family. We've had to put a lot of our lives on hold. Again, we can't put pregnancy on hold, so we need to get on with really knowing what we need to know and sharing that information as we get it. So what I'm really, really pleased about is that we have a group of experts with us at the March of Dimes. We consider ourselves expert on the issues of moms and babies, but we're not the only ones. We've got a lot of people out here that know what they're doing and are experienced and are experts in this space. And we're just really, really pleased to invite them to join this conversation and to support your needs, to get information out that you may need today and that you're really wondering about and you want to hear from somebody you can trust. So I'm really pleased that we've got those people with you today. We have expert panelists. I want to introduce them. First, I'll introduce at the March Times our Chief Medical and Health Officer, Dr. Rahul Gupta. Dr. Gupta is also a former state health commissioner from the state of West Virginia, and so we're really pleased to have him joining us. I also want to introduce Dr. Lisa Hollier, who is the former president of the American College of Obstetricians and Gynecologists, ACOG, and she currently serves as the Chief Medical Officer for Obstetrics and Gynecology for the Texas Children's Health Plan, and she's in Houston. And lastly, but certainly not least, my good friend Latham Thomas, who is a celebrity doula and also the founder of Mama Glow, which is a premier maternity lifestyle brand in New York. And she's been a great friend of the March Dimes for a long time. So I'm going to moderate this conversation today. I'm going to ask each of the panelists to start off with just a few comments, pose a few questions to them. We are going to leave a lot of time during this for comments and questions. So please use the chat box if you're watching this right now. Input your questions. We have folks monitoring those questions. I'll be able to get those questions and hopefully ask questions. We'll have people online answering questions too. And if you, we'll do our best to get to all the questions that you've got. And just know that we're going to try to get as much information out as we possibly can. So again, let's get started. And thanks for all of you for joining. And certainly thanks to all the panelists. So Rahul, I'm going to turn it to you. And you're a public health expert. I mean, you've spent time at the state level, at the federal level, thinking about public health. Let's just ground us in this conversation about COVID-19. We're hearing a ton of information. I think we all think we're experts, but if you could just set the stage for us. What is COVID-19? What is a pandemic? And as pregnant women, what are some of the symptoms, that we ought to be thinking about, and all of us ought to be thinking about and noticing?
Absolutely, and thank you for that introduction, Stacy. Thank you for my co-panelist for having this discussion today. A very important discussion indeed. A pandemic really happens when you start to have any type of novel virus that spread across at least two continents, and that certainly has been the case with this particular novel virus that has elements of various DNAs, including that of bats, that initiated itself from a particular Wuhan province of China. as it has grown where we are today, is that the United States stands to have the most cases of any other nation. As of yesterday, we had about 163,000 cases with almost 3,000 deaths. It is unfortunate that we're undergoing this particular crippling pandemic that is putting us at risk. Now, COVID-19 particularly is a type of coronavirus. It is the same as what we're commonly saying coronavirus infection, but so far it seems to have impacted drastically those who are elderly over 65, specifically over 85 years of age in terms of mortality, deaths, but also people with underlying health conditions such as heart, lung disease, as well as diabetes. The most common symptoms tend to be difficulty in breathing, cough, and fever. Wherever we're finding new information that a lot of people could also be asymptomatic, as well as have other symptoms such as gastrointestinal illness in a small percentage of those people. It is able to spread through droplets and contact surfaces. So that's just the overall of what it's like and where we are today.
And Rahul, one of the things that I think we started hearing so much about the fact that people, elderly people and immunocompromised people were the most at risk. But how should we be thinking about pregnant women that are pregnant? Are they at risk, and how do we think about that?
Yeah, let me begin first by saying that it is not unusual to see pregnant women and children fall behind in the line when we have new pandemics. That information first focuses on populations that are dying first and foremost. And therefore, we often, whether it's drug trial treatment trials or vaccines or just measuring, pregnant women are not the first and forefront in most pandemic situations. However, it is critical that the health of pregnant women, almost 6 million women in the United States today, is kept in mind as we are developing this. We are beginning to see that while pregnant women may not be at higher risk than the average population, but once pregnant women do get infected, the outcomes could be difficult or tough to manage afterwards. We have only data coming out from third trimester pregnancy, most of it. So we don't have a lot of data on early pregnancy outcomes. So because the focus hasn't been on so far, and we're definitely, Dr. Ollier and I know later we'll talk about this, but we're actually focused to make sure that we understand and we don't know what we don't know right now. And we're trying to find out because there are so many more unknowns about pregnant women and infants at this point.
Thanks. So, Dr. Hollier, Lisa, give us a little bit more. So, I'm pregnant today. Let's assume I am. I'm not, but there are women that are listening that are. Yeah. So, what is the risk to me? What is the risk to my baby? If I have symptoms, what's the risk if I don't have symptoms today, but if I develop them over a period of time? Give me a little better sense of what should I expect and what impact could I have on my baby if I do get sick?
Thanks, Stacey. I just first want to say thank you so much. I'm a lifelong volunteer and supporter of the March of Dimes, so I'm really delighted to be able to be here today with all of you to talk to all of the wonderful folks that we have joining us to listen today. As Dr. Gupta said, the majority of people who have this infection are probably asymptomatic. They have no obvious symptoms. But as he noted, this disease can progress to involve serious problems with breathing and also can have serious problems for the kidneys. Because this is such a new infection, the information that we have specific to pregnant women is really pretty limited. First, we don't yet know or fully understand whether or not pregnancy makes someone more or less likely, more likely to get sick. Now, looking at current reports, according to the American College of Obstetricians and Gynecologists, pregnant women do not seem to have more severe symptoms than the general public when they are infected. Now, researchers are still learning a lot more about pregnancy and the effect of this infection on pregnancy and the effect of pregnancy on the infection itself. So what can you do? The American College of Obstetricians and Gynecologists has a team of experts who are on the front lines who are working on getting new answers every day. You can check out the website at www.acob.org. But most importantly, I really want to encourage you to talk to your obstetric care provider. Talk with them, get some really valuable information. Let's talk about your fetus. Let's talk about the potential there. Right now, it's still a little bit too early to know how COVID-19 might affect the developing fetus. In reports, as Dr. Gupta mentioned, from countries that were affected early, some women did in fact have preterm births. Now, it's hard to know for sure whether or not those preterm births happened because of COVID itself. And finally, researchers are still collecting information about whether or not the infection can be passed from the mother to the fetus during the pregnancy itself. This is another area where I want you to encourage you to talk with your provider because new information is constantly unfolding.
And on that point, there was a lot written early on that it was probably not likely that the virus could be passed from the mother to the fetus. But then there was this recent article in the Journal of the American Medical Association that said that it couldn't be ruled out. Isn't that right?
That's true. There were some recent articles in the Journal of the American Medical Association, and researchers are still really looking at these reports very carefully to understand the type of testing that was done, the accuracy of the testing that was done. So I think we've got more to come.
So we'll talk about, what to expect in the hospital and things like that, because I know there are a lot of women that are thinking, well, okay, fine, I know I need to stay safe, but I am going to have to show up in the hospital. So we'll come to that in just a second, because I think a lot of people are very interested to know, so what do I do when I show up on delivery day? But Latham, I want to turn to you, because as a doula, you are in the business of helping women give birth and do it successfully. And we know doulas often are critical in helping moms deliver more safely, more effectively. Doulas provide the kind of relief from stress and anxiety that can complicate pregnancy and childbirth. So how are you thinking about this right now? And how do you think moms today ought to be thinking about preparing for birth? And whether they're working with a doula or not, what are some of the things that you're talking to pregnant mothers about today in light of COVID-19?
Sure. I just want to also thank everyone for being here and the incredible co-panelists that are here today. And thank you to the March of Dimes for all the work you all are doing and just leading the charge in making sure people get access to this information in a really sustainable way. So, I think it's really interesting being in this time and seeing sort of how in just 3 weeks, it seems that not only our economic system was so frail, but our medical system is really strained. And in a time like this, it's really important for non-clinical care providers to be able to help fill some of the gaps that we see in terms of meeting emotional and psychological needs of people who are entering into the medical system very shortly to deliver their babies. And so what has happened as a result for protective and safety measures to ensure that hospital staff are safe and families and folks who are actually in care in hospitals is to minimize the amount of people who are coming in. Doulas have actually been, well, I shouldn't say doulas specifically, but the rule for most hospitals has been to exclude the 2-person minimum and bring it down to 1 person that you could bring in for support. Some hospitals have ruled out support completely so that some mothers are going into hospitals alone. And when we hear that, obviously it's incredibly alarming to hear. We understand that we're in times that are just unprecedented. So there's a lot of measures that are being taken to protect everyone involved, especially as information is changing every day. But for us, it's really important that there's a patient advocacy safety net in place in times like this, that mothers and families are able to advocate for their needs, be able to understand the language of how to ask for what they need when they enter into a system, but also understand what limitations there are barring the fact that the hospitals are already constrained. There's providers that are working overtime, and there's also spatial constraints that are just a result of COVID patients that are in isolation. And a lot of the resources that you might have had on the maternity unit are also being pulled to the COVID unit to make sure that those people who are in isolation have support. So what's been happening that I think is really great in some ways is, to accommodate people who aren't able to have the doula that they were with the entire pregnancy, is a lot of hospitals are saying you can have digital support. So if you have an iPad or a phone or some type of device, you can bring that in and set that up. There's a lot of little tools that you can order online that can help you prop those things well in the hospital. But I think it's a great way to make sure that you can have that continuity of care.
Can I just ask you a question about that?
Mm-hmm.
So is that also true for prenatal visits? And maybe you or Lisa could comment on this, because there are women that are just, they're a little further away from delivery, but there's some limitations, right? That some OBGYNs may be placing in their own practices about limiting the number of people coming in even for prenatal visits. So is that an issue to be thinking about or to be concerned about? And is telehealth or these virtual methods another way of getting around that as well?
Yeah, I'll speak to that, and then I'll have Lisa follow up because I'm sure she has a lot of things to add. Absolutely. A lot of people have reached out and said, I'm really upset that my partner can't come to the appointments anymore. And a way to sort of, allay the fear is to say, when you go into that appointment, using the FaceTime or using other tools that we have, we're on a Zoom and a Facebook Live right now. This is you're able to do this from home. You can also contact your practitioners this way. A lot of people are trying to accommodate the needs right now and use the technological tools that we have that are low entry for people, so that you don't have to learn how to use something, but you can use the things that you're used to using already. A lot of mental health providers have offered themselves up in this way as well, where they're offering tele-therapy sessions to help moms move through the emotional and psychological strain of having to navigate this time. And so, and that's also happening in the doula space. So what we're doing collectively and with people who are, we're all around the world trying to help meet the need by providing access to tools, providing virtual support, virtual doula education with clients, and then also being able to equip them with the tools they need to enter into this process with more confidence. I think one of the things to also think about is, when we have this in place now, as we're just meeting the need, it'll help us to further adapt and figure out how we can build systems in a way that are sustainable. Should something happen like this in the future, we'll have a system in place. So I think it's unfortunate that we're in this space, but I think we do have the technological tools to meet, some of these needs that people have. And hopefully we're able to pivot in this time to address the needs of families and support them in a way that, they can make the best choices for themselves.
Yeah, I think pivoting is what we're all doing. That's exactly right. And Dr. Hollier, Lisa, I want to ask you to talk about OBGYNs. How are they adjusting now to meet the needs of their patients? And what should a woman know today or be able to say to her OBGYN to get the support that she thinks that she needs? And what are OBGYNs doing to respond to those needs as well?
OBGYNs are absolutely committed to patient-centered care, and we fully appreciate how difficult these times can be. One of the wonderful things that I've seen, just like Latham mentioned, was the shift to much more use of technology. Many physician practices, many collaborative practices are moving to a situation where we're doing a lot more telephonic or telemedicine. And it has been a really wonderful way for us to have meaningful connections with our patients, to meet their needs in a very patient-centered way without having them come into the office and run the risk of exposure. So I think this is a really great opportunity for us, and I look forward to continued use of this technology.
So the real question a lot of people have on their minds, right, and I know it's showing up in the chat a lot, is, look, I'm going to go to the hospital. I'm going to deliver my baby. Is it safe? Is it safe? What's it like in the labor and delivery room today? Is there PPE? What precautions are being taken for those women that are coming in, delivering their baby to keep moms and babies safe? Is there separation of those patients from COVID-19 patients that the same hospital might be treating? Like, what's it actually like? And Lisa, you're in a hospital here. Tell us what it's like in your hospital. Tell us what it's generally like in other hospitals as well.
Well, I think it is important to understand that you may see some variations from one hospital to the other, depending on the location, depending on the community prevalence of the infection. What you are going to see is a lot more social distancing. You are going to see a lot more personal protective equipment. That's gowns, masks, gloves, things like that for your healthcare team. So those things are definitely going to be different. The check-in process may be a little different. There'll be screening that happens at the check-in. And in fact, you might even have screening questions that are asked of you before you even get into the hospital. There are some hospitals who are, doing that separation that Stacy was talking about, separation of patients who are known to be infected. I think the thing I really want you to understand is that your obstetric care team is really there for you. And we are working incredibly hard to deliver the patient-centered, respectful care that you deserve. And I'm delighted to let you know that the American College of Nurse Midwives, and in partnership with the American College of Obstetricians and Gynecologists, the American Academy of Family Physicians, and Society for Maternal Fetal Medicine all got together, and we recently released a statement about the safety of delivering, the continued safety of delivering in hospitals and in birthing centers that are both licensed and accredited. So I want you to know that your obstetric care team is doing everything we can.
And is it on a hospital by hospital? We're talking about whether or not hospitals are allowing a partner to come in or whether or not they're not allowing anyone. I assume that's on a hospital by hospital basis. So you should probably check with your hospital before you plan to deliver on what their current policy is. Is that correct? Of whether or not they'll let a partner come in with you?
Yes, I think that's a really great idea. I mean, I feel like I keep saying over and over, talk with your obstetric care provider. I think that's a really great idea. Call ahead, understand exactly what to expect at your particular institution. And I know Latham has some other ideas as well.
Yeah. I want to come back to something else though, before we go back to Latham or Rahul, which is we actually have, I guess, online a lot of folks that work in health systems today. And there's some folks that are asking about whether or not healthcare providers who themselves are pregnant, how should they be thinking about going to work every day? Is it safe for them to go to work? If I'm a pregnant nurse or a pregnant health worker, what guidance do we have for them? What should they be doing, and how should they be thinking about it? Should they not be showing up? Should they, what protections or precautions should they be taking right now? And that's for Lisa or Rahul or any or Latham, any of you.
I was going to say that a lot of institutions have very specific guidance for their employees and staff. And so I think it's really important to keep in very close touch with your institutions to understand what their specific recommendations are.
And I will just add also, that's very similar to what Dr. Olia just mentioned, which is, if you're worried and you're coming to work, talk to your employer. This is a great time to have that conversation with your employer about your specific risk related to your work and your status as a pregnant woman. And you'll be surprised sometimes how many options open up, and they're just maybe too busy and not thinking about that. And once you bring that up, there may be other options for remote work that may be available to you and to your employer. So talk to your employer, have that conversation. But at the same time, I just want to mention one more thing that I know is important to all of us on the panel, which is make sure you don't miss your prenatal visits, whether they're happening virtually or in person. Make sure that those are not one of those trips that you are planning to miss.
I definitely would agree with that. And one of the things I just wanted to mention about the March of Dimes is that we just today put out a statement about really supporting the idea of at least one partner being present with the woman. And that's based on WHO and CDC guidelines. We think that that's really important, and to take away that support system for a mom who may need it when she's at the point of delivering. could be very traumatizing. And so to the extent that all the right precautions are taken to protect health workers, to protect the family, we encourage hospitals to accommodate as much as possible. We also understand that hospitals have to make their own decisions about what they think is in the best interest of public health at that moment in time. Latha, I'm sorry, I want to come back to you.
I was just going to say, to add on about the piece for, nurses or other care providers. It's an incredibly stressful environment when people are going in. They're already going with the fear that's not only of what they're seeing in the workplace, but also what they're hearing in the news cycle. And so when you're going into an environment that's increasingly more stressful and you're pregnant, there's risk for preterm birth, there's risk for other illnesses, you become immunosuppressed, which makes you more open to exposure. And so one of the things I think that's really critical for care providers to be thinking about too is how they're managing their own mental and emotional health. And so having access, and a lot of organizations, apps and things are coming together to actually provide a resource for care providers so that they can have a way to alleviate stress and manage stress during this time. So it's just another thing to be thinking about that we're layering in terms of making sure you have adequate supports, but that you manage your stress well during this time.
That's a great point. And maintaining all of our mental health is so critical right now. We talked about, can the virus be transferred, from the mom to the fetus? I want to talk about, so when the baby is here, and in this environment. So a couple of questions. First, I've had my baby and I'm planning to take my baby home. What should I be thinking about at that point? Should I limit the number of visitors? Should I limit the family members? Is there social distancing with babies and other people? What's the recommendation on what to do in terms of when the baby actually comes home? And I'll open it up to whoever wants to answer.
Go ahead.
Lisa, do you want to start?
First, I have to come off mute. I think one of the things I want people thinking about, certainly before they're even leaving the hospital, is breastfeeding, and maybe you want to talk about that separately.
Yes, I'm going to ask a question about that.
Okay, so I think it's really important to maintain that social distancing from other outside individuals. Do limit those visitors coming into the home. It's always a good idea to avoid any potential spreading of virus to an infant, thorough hand washing, all of the things that we're doing right now to really help keep ourselves safe from catching or transmitting the virus.
And so there may be no grandparents for a little while, maybe, or aunts and uncles, probably.
Technology, right? Technology,
virtual visits with the family. That's right. Lathan.
I was going to say, definitely using technology and live chat is a great way to, you can have like a meeting where everybody can meet the baby at the same time. There's so many tools. Sending a group text where maybe there's like a thread of everyone's contacts and you can give them updates. And so it minimizes the effort on the parent side. But parents and, people who would normally come and like give food and help you with recovery, they should send gift cards and things like that like help you be able to figure out how you want to manage what's coming in, because they can't help you physically. I think also just managing the expectations around holding and touching the baby, because people always expect that. And, there's ways that mom and the partner can make sure to minimize the distance and make sure people have some time, some space to visit. But like, obviously, like Dr. Lisa said, virtually makes most sense. But then, as much as you can, wearing a mask and gloves and making sure to not allow anyone who's exposed to visit. A lot of people have folks that they rely on who come to take care of. Some people have hired baby nurses or, other types of support that comes to the house frequently. And you just need to make sure that everybody also is healthy. So there's ways to do temperature checks. You can check for respiratory symptoms to make sure that the folks who are going to be in close contact with you, maybe you have a postpartum doula, that these people are also very safe.
And also, remember that babies do not have a more robust immune system to begin with when they're young.
That's right.
And for a lot of even the vaccines, those things don't work until the first 6 months. On top of that, remember that baby may have siblings in the home. And a lot of the, we know about smaller children or children overall, that they can have mild to moderate illness with COVID-19, not as severe as some of the older adults or the grandparents. So it's also important to take a note and keep that in mind when you are having your other siblings interact with the baby, the new baby in the home.
Good point. I want to, Lisa, you raised it earlier. I want to get back to that question about breastfeeding. So what are the precautions that a mom should be taking around breastfeeding, and how should she be thinking about that? And I know there's some guidance out about that as well. So I don't know who to go first. Latham, Lisa, Rahul, who wants to jump in first?
Latham, why don't you jump in? And then I can follow you.
Latham, why don't you start?
Sure. So, we don't have like robust information right now. We're just seeing the data, and it's constantly sort of changing around breastfeeding. What we know in most cases is that breast milk and breastfeeding is the preferable option and the safest and healthiest option for developing infants. If there is an instance where someone is severely impacted by COVID-19 or sick in any other way, there are ways to get breast milk to the baby if the mother has to be separated for any length of time, or if the baby has to be separated for any length of time. People can manually express and pump. You can also, there are also milk banks for folks who do want breast milk and they want breast milk that's been screened. You can also, I'm always like breast first and trying to make sure that people have like adequate tools and access where they can before we like look at other options. But I think that right now we just don't have the data that shows us enough to be able to say discerningly that that everyone's safe, in this instance. But what they've shown so far is that they haven't seen breast milk come up we haven't seen COVID come up in breastfeeding moms. So the milk provides antibodies. It provides so much support to developing baby that we want to make sure that moms feel safety in breastfeeding and know that they should do that. But I think having contact with your medical provider, making sure that you have adequate information and that you're checking also the CDC website, the World Health Organization, also looking at ACOG's website. There's always tools there as well to help you navigate this time, because it is changing, and every day we check and there's new information going up. So while we can't definitively say, I think that we do need to sort of prepare ourselves to have the tools like a lactation consultant that you can check in with virtually that can help you make sure that you're getting things going, who can also help disseminate information to you about the virus and about how you can get around the feeding challenges if you are somebody that you think has been exposed, or if you are currently a carrier.
Great. And Lisa, did you want to add to that too?
I really don't have anything to add. I think that was just an awesome job. That was really perfect.
Yeah, and I just want to reiterate, I think what we are seeing is that there hasn't been a detection of the virus in breast milk or the amniotic fluid, as we understand it now. But again, these are things that are getting all updated, and we certainly want to encourage women as much as possible, if they're able to breastfeed and to know how to do it safely. Now, there are some other questions, and I'm actually picking up some questions that are coming up on the chat too. They're getting sent to me, so I want to make sure you know that we're seeing your questions and going to try to respond to them as much as possible. There are some questions about showing up in the NICU, and there are women that may be at more risk of developing prematurely. Their baby may have to go to a neonatal intensive care unit. How can they help ensure the safety of a baby who may be in the NICU? Are there things that NICUs are doing in response to this? And certainly we're hoping that women are not having to deal with that situation, but the unfortunate reality is that is going to be a situation for some women. So Rahul, do you want to start with that and just talk about what the NICU situations are like right now? And the March Times, we have a lot of partnerships with NICUs around the country. We have a NICU family support program. So there's a lot changing in this space as well. Rahul, what can you tell us about the NICU?
Yes, certainly. As some of the families will go home, others will unfortunately end up in neonatal ICU, or we call NICU. And while that is happening, the experience does not have to be a negative one, meaning that we have tremendous amount of technology now to make sure that those babies are being saved at very early stage with a lot of complex conditions as well. As that happens, we at March of Dimes continue to provide support to these neonatal ICUs all across the country. And part of that support is to be able to know what specifically to expect. We know that at this time, some of the NICUs may be understandably limiting the visitors, and there may be also a limit on other providers that may be coming, like lactation consultants and others. So it's very important to make sure that all of your questions when you're in NICU are being addressed, all your concerns are being addressed, so ask those. Secondly, make sure that you have all that information with you. One of the things we have at March Times is our My NICU Baby app. It's been downloaded tens of thousands of times. It's a very popular and useful sort of resource to have. But your hospital may provide you, and your center may provide you that or something similar information. It's very important to be equipped with all the information you can have. And make sure when the time comes for discharge planning, that you are actually working proactively to understand the technology as well as the other aspects of what you're going to be using at home. Because, in NICU, you're going to have all of this support, and then you're going to go home and you might feel that you don't have that support. So it's very important that transition that happens, especially in time of COVID, that while you're keeping yourself, your family, and your baby safe, you're also empowering yourself to have all those questions answered ahead of time, and have someone that you can continue to talk to and consult with when you do go home.
I've seen a lot of NICU moms online talking a lot about, well, this physical distancing thing, we've been doing this all the time. This hand washing thing, this is what we do, right? So in some ways, women that have had a baby prematurely or have had a baby in the NICU, they know exactly what this world is like. They know about physical distancing and social distancing. They know about hand washing and how important it is to keep, limited number of visitors and things like that. But babies in the NICU are even more vulnerable, right? I mean, their health is a lot more precarious in many situations. So are there other safety measures that parents really should be taking at this time if their baby does it in the NICU? And what should they be looking for in their hospital to make sure the hospital is itself taking the right precautions as well, just to be a good parent advocate on their behalf?
Yeah, I'll mention a few, and I'll turn it over certainly to my colleagues here. I think one of the most important pieces is look, what is your baby going through? Because some of the lung conditions that can become chronic, or nutrition issues that can become and lower your immunity for the baby overall, because you don't build enough proteins and you can't build enough antibody response, and that's where breastfeeding comes into role. Those conditions that could be specific to your baby could be very important, both in the risk of acquiring an infection from COVID, as well as recovering from it and the complication that could ensue. So it's going to depend on your condition of your baby and how well the baby is doing. But some of those conditions, as we mentioned, underlying lung conditions, heart conditions, to a fragile baby could be very important and make all the difference. In terms of hospitals, it's really important that you're getting the level of care at the level of NICU. So make sure that goes back to, if you're being provided a care at a level that you're satisfied with, that's great. If not, then you got to talk to the administrators. At this point, I can tell you the hospital folks are going to make sure that you're getting the best care possible in the most difficult circumstances and challenges with resources. So I'll turn it over to my colleagues as well.
Yeah, and I just want to say, and Lisa, I don't know if you want to add into this, but I definitely think that, this is a time to really give a shout out to healthcare workers everywhere and hospitals everywhere for what you're doing for us, right? And we certainly appreciate all of what you all are doing, and you all are a bunch of heroes and sheroes that, you know, we can't say thank you enough to. Lisa or Latham, did you want to add into that? Because I had another question around, if we could. I'm trying to squeeze in as much information as we can here. If we could switch a little bit, because there's another question that's been coming up around women with underlying health conditions, right? We know that this has been a big problem. You know, obviously, a woman that is not as healthy as she possibly can be before pregnancy can often run into health challenges herself during pregnancy or even after pregnancy. They can create challenges. And now, if you have an underlying health condition in a pandemic, boy, what does that really do? And what should a woman be doing or thinking about if she's already facing some underlying health conditions, and is she at even more risk?
There are some underlying health conditions that we believe probably do put women at a higher risk. When we look at the general adult population and who has been at risk in that population, cardiovascular disease is a significant risk factor. And as Dr. Gupta had already mentioned, lung disease can also be a significant risk factor. It's going to be incredibly important to talk with your obstetric care team. It's very important so that this discussion that you have with your obstetric care team really takes into account your particular situation, your individual risk factors, and then you have a very personalized discussion and assessment of any changes that might be necessary for your prenatal care. There may be some changes in the frequency of your visits that might be appropriate. There may be some additional recommendations for you, but it's really important to have that discussion so that you can have an individualized care plan that really meets your needs. Dr. Gupta talked about for neonates, the importance of levels of care and getting your care in a risk-appropriate facility. And that's also true for moms. If you are a mom with a complicated pregnancy, you're probably already planning on delivering at a facility that has risk-appropriate care. So I just, again, want to encourage that personal discussion and that individualized care plan with your obstetric care team.
That's great. We've had a question come up about ventilators. That's been so much in the news recently. And there's a question about just a concern of ventilators for mom and NICU babies. Should that be a concern? If for some reason a woman that's in delivery needs one, do you think they will be available for her? What are the particular concerns that may be on the minds of some people as they're thinking about going to the hospital and having that need? Lisa, do you want to take that? Or Rahul? Yeah, go ahead.
Yeah, I'll start at least. I think ventilators, as we're finding out at a national level, are one of those stockpile issues that have become a problem. And part of that goes back to our ability to have a safe and secure stockpile and be prepared. But really the issue will vary where you live, because there is not a shortage everywhere. There are going to be areas like New York City, New Jersey, some of the areas that are actually seeing a really surge in patient visits and a lot more cases that translates into a lot more sicker people, a lot more dying as well. And obviously the need for ventilators becomes first and foremost. Now, there's good news on the horizon, which is from what I hear from public reports, that there are some contracts being executed to get more ventilators into states like New York. So pregnant women should not be afraid at this time that there will be a lapse and the need that would there be. But once again, the best thing you can do for yourself right now is to take all these measures that we're talking about today so you can avoid your risk of getting the disease to begin with, so that it does not become a serious problem as relates to COVID. Because all of the health systems are being surged, especially in areas where having a lot more community transmission of the disease.
So there are a lot of women that are not pregnant right now. There are many women who were thinking about becoming pregnant. There are many women that were in the process of maybe fertility treatments. I'm sure there are a lot of women saying, I don't even know if I should be getting pregnant at this point. How should I be thinking about that? And should I delay? Should I wait? Should I go ahead and, just deal with the situation as it is? Latham, do you want to start on that?
I think it's a challenge for anyone who's been really hopeful about starting a family to now be faced with this on a horizon. And obviously, it's completely, we're in a place where we're just seeing the beginnings of what this, the impact of this COVID-19 pandemic will be on our society. But really, if you think about what families have to really be thinking about, there's economic constraints right now. So if you're somebody who was planning for, to look at fertility medicine and reproductive technology, then your access changes based on like if it's considered an essential service or not, right? Like if you're in a place that's heavily populated, like New York City, or a dense place like Los Angeles, where there's been shelter-in-place orders, people's services have actually been halted in many places. We know, like NYU, for instance, they may have to fold their entire fertility program for the time being because of what's happened and because of resource constraints. So it puts a lot of strain on people who are currently in cycle, people who were planning, for this year, and folks who are trying to figure out whether or not the timing is right. Because we're in an economic collapse right now, it also means that a lot of people aren't working or don't have benefits like they did. And so where you might have had the ability to figure out how to piece together a way to pay for your fertility treatments, it may not look the same on the horizon in a month or two from now. So I think, again, when I sort of think about this holistically, I think the stress is really like something that overcomes a family in a time like this. And not only that, I think it impacts the relationship between the two people or the person that's trying to get pregnant. And so I think that there's so many resources and tools for us to sort of figure out like how to find access to care providers and to people to speak to about like a course of action. And that's going to be specific to your region, that's going to be specific to your case. But I do think that we can all be finding community groups online to find support and convene and connect with other people who are going through similar challenges, to aggregate resources that way, and to figure out like, does it even make sense right now? I mean, it's really hard to tell somebody don't do it now, right?
It's a personal choice, right? I mean, it's a personal
so personal, but it does feel like a really intense time to be thinking about starting a family if you do have the opportunity to, think about it later in the year. It might be better. We don't really know where our health system will be. We don't really know what it means also to go through a process like this. And everyone's trying to make sure they meet your safety needs at the same time and protect their providers. So, and it's a very high touch experience going through fertility cycle. There's like nothing, I mean, this is fine for us to do, but it's not fine in that setting. You have to do a lot of appointments, and there's a lot of blood work, and there's a lot of connection that's involved, and rightfully so. So I think people have to just, weigh out their
that in, right? Yeah. And Lisa, we talked earlier about, but say I'm in the process of fertility treatments and I already started that. What do I do now?
Well, again, speak with your provider to get specific information, but based on the guidance from the ASRM, the American Society for Reproductive Medicine, it looks like ongoing cycles can be continued, while new cycles, in fact, might not be started.
Right. So one last question about all of this, which is really around, and Latham, you touched on it really around, so this is a very stressful time, right? And it's difficult for people that have the best health. For women that are pregnant, it's unusually stressful. We've actually experienced that with people very close to us at the March of Dimes. So what are some of the ways that women can sort of reduce that stress if you're pregnant today, so that you're not overburdening your own body because of your feelings of anxiety and stress about delivering your baby? What are some of the tools and tips that we can share with moms about where they can go to get help to address that anxiety and stress. And hopefully just getting information out like this is helping at some level, but we certainly want to make sure that there's more help available. So Rahul, do you want to start on this?
Certainly, and this is a great question because the majority of us are wondering, what to do, and some of that, as was mentioned by Latham, is some of these things, the maternal stress, unlike other conditions and other populations, it actually has an impact, not directly from infection, but indirectly from preterm birth, low birth weight, and all. So it's very important for us to reduce our stress to begin with. And I think some of that's make sure that you're going to credible websites. You're getting good information when you're looking at, follow the guidance. March Dimes, ACOG is certainly a great website as well. CDC is, of course, the premier website as well for the country. So get your information right place. Talk to your provider. Make sure you're getting the best information. Make sure that your vaccination, other coverage that you are going to get are up to date. But then also put science to work. What I mean by that is, we now know that, the droplets can be aerosolized, stay in air for 3 hours. We also know that, if that's the case, don't stop your exercise. Just take that exercise and then walk in the morning when most people aren't going to be there. Those type of things. There's ways to continue your routine. So make sure that you're getting the full diet, exercise, and sleep. But then make sure that you're learning more about the virus and the way it behaves so you can counteract that and actually continue to maintain your regular schedule so that you can have the best possible outcomes from your pregnancy.
Great. Latham, any tips for moms on stress and anxiety?
Yeah, I would say, this is a great time to become more educated. We're all at home. There's books everywhere. Like Rahul said, there's websites to research. You could put together a syllabus for yourself to really become educated and become the best advocate that you can for yourself and your growing baby. I also think that it's not something that we should feel like we do alone. We've evolved in communities. We're used to being in support of each other. We're all in a group chat right now talking to you. We're not doing this alone. And it's because we're meant to come together and work together. And so I think finding access to a virtual doula during this time could be really beneficial because you'll have somebody who can support you in a non-clinical way, but emotionally, psychologically, who can share tips and tools for you to navigate the birth through comfort measures and other techniques, and who can also help you learn to speak the language that you need to speak when you're going into the hospital to advocate for your needs. So I think that there's so many, everyone's pivoting to make sure we can meet the need to support the folks that are there. But it's a great thing to have in your back pocket, and we can connect just like we're connecting now. We have virtual tools. We all can meet people. There's folks who are working on a sliding scale. There's lots of webinars and access to tools that are provided by people in the medical system and outside. So just make sure that you feel like there is, that you're connecting with people who you feel like share similar values or help you feel calm and get information from places that aren't so scary. I know it's all really scary right now, but there are some people who can help package it and digest it for you so it's snackable and you feel like you're getting something that's useful. So I would recommend doing that. We have a bunch through mamaglow.com, but there's tons of people online that are offering services. So just stay aware and use the resources of your people, your communities, and your social networks to kind of get more access to these tools so that you can thrive through the process.
Yeah, I think those online communities are great. I know at mamaglow.com, there's a bunch of information. At March of Dimes, we have a Facebook page or Facebook community page that you can join and get support. We also have something on our website at marchofdimes.org called Share Your Story, which is like a virtual community where people share different information. So as much as you can seek out not only the credible information, but just the support of other moms and others that are in similar position can be really helpful. We're coming to about the end of this, but Lisa, any last thoughts about what moms can do at this point to manage through this crisis?
I think that March of Dimes has really provided a wonderful opportunity today, bringing together this great panel. My co-panelists are absolutely wonderful. And I hope that the information that we've been able to provide to you today is really helpful, helping you truly understand some strategies to help you reduce stress at home, maintain your contacts with your friends and family, develop new contacts through online mechanisms, get the healthcare you need through mechanisms like telemedicine or telephones, and really just have a much better understanding of, as Stacy said, what to expect when you're expecting in these very challenging times.
So I just want to underscore, because there were some people saying, oh my gosh, is it safe to go to the doctor right now for my prenatal visits? I know the OBGYN that is, I deliver my babies at their practice, and I know they're limiting the number of people that can come in for the visit, but they're encouraging everyone to still show up. Like Rahul said, don't miss your prenatal visits. Some of them can be done virtually, which is great. But if I know OBGYNs are doing all that they can do to keep their offices safe and doing all of the right things to protect patients. So taking care of yourself and your baby through this period of time is critical. And just know that there are a lot of us out here trying to support that and make sure that happens. Also supporting the health workers who are trying to make sure that those outcomes are as good as they can be. We're going to pull this to a close, but I just want to say, first of all, thank you to all of you all, our panelists, for being here. Lisa and Latham and Rahul, first name basis for everybody. We're all good friends. You guys have been amazing. This is the first episode of Healthy Moms and Strong Babies. We're going to continue to do this, as I mentioned, every week. Don't forget to visit marchdimes.org. And some other websites that we mentioned. I think some folks are putting them in the chat as well, of different online communities to go to. I just also want to say too that part of what we're doing, what's enabling us to do this today, is the support that we've gotten from a lot of you all and from the public. And I just want to say that if this is helpful to you, and if you want to see more topics, if you want to help us continue to do this kind of outreach, we want to do this, please support us. You can text to give at ModGive to 51555 and get more information about COVID-19, the pandemic, what to do during this period of time. If you were thinking about becoming pregnant, you are pregnant, you just gave birth to a baby. We want to continue to do these on a weekly basis. And of course, we will be doing another one next week that will focus a lot on mental health and mental health support. So again, thank you all for joining. It's great to be with you all. Leave us some chat, some comments on what you thought about today. We'll incorporate all that into as many of our sessions going forward as we can. And thanks for joining the conversation today, and look forward to coming back. We look forward to seeing you at March of Dimes on the Facebook page next week, next Thursday, April 9th, for another episode of Healthy Moms and Strong Babies. So thanks for joining, and have a great day, everybody. Thanks, everybody.